Okay, we could continue sa stomach channel of food Yangming part 3. Okay. We have this stomach 39. Observe po natin dito sa picture. The location, 1 tune distal to stomach 38. So nasa baba siya ng stomach 38. Midpoint, ang stomach 38, midpoint of the line joining stomach 35 and stomach 41. And 1 finger breadth lateral to the anterior crest of the tibia. Yung point explanation, similar to stomach 37, this is the lower C point of the small intestine and is used for influencing its function. It is especially effective in the treatment of colic, young diarrhea, and pain in the small intestine. When used with sedation technique, it can also be given with tonification technique when treating distention and malabsorption diarrhea. Next point, we have stomach 40. Tingnan po natin yung illustration which is nasa midpoint ng stomach 35 and the lateral malleolus. Sa location, at the midpoint of the line joining stomach 35 and stomach 41, 2 finger breadths lateral to the anterior crest of the tibia or 1 finger breadth lateral to stomach 38 between the extensor digitorum longus and peroneus brevis muscle. This point is the loop connecting point. It is said that one of the earliest changes in aging, which begins around 35 to 40 years old, is the decreasing of spleen and stomach function. So, nasa age 35 to 40 years old, decreasing na po ang spleen and stomach function. This causes poor digestion and absorption and distribution of nutrients, poor circulation of thick fluids in our body, and therefore stagnation of these thick fluids in various parts of the body. This causes dampness, which manifests as edema, stiffness of joints, mucus condition in the respiratory organs, sluggish functioning of the organs, feeling heavy and lethargic. These symptoms are treated by changing one's diet to include more whole meal, grains, eating warm and cooked food, avoiding refined carbohydrates and sweets, fatty dairy products, and so on. The best point used in this case are stomach 40, spleen 9, UV20, and the vacuum point of the spleen to improve the function of these two organs. Point stomach 40 is considered symptomatic point for dampness and improved circulation of thick fluids. Next point, we have stomach 41, which is located on the front of the ankle at the level of the line, joining the prominence of the lateral and medial malleoli, in the depression between the tendons of the extensor digitorum and extensor hallucis longus. Ang point is used sa tonification point of the meridian. It is good for improving hunger and appetite. So check po natin sa picture, nasa may dorsal ankle joint. Next point, stomach 42, which is located on the highest point of the dorsum of the foot, between the tendons of the extensor hallucis longus and the extensor digitorum longus, directly lateral to the point where the dorsalis pedis artery may be palpated. The point is bordered proximally by the second and third metatarsal bones, and distally by the second and third cuneiform bones. Alternative locations, sometimes this point may be located lateral to the medial portion of the extensor digitorum longus tendon, joining the second toe. This point is the U1 source point of the stomach meridian. It is used sometimes to sedate stomach yang in conjunction with the loop connecting points of the spleen, which is the spleen 4 or spleen 21. Next point, we have the stomach 43, check po natin yung picture, which is located on the dorsum of the foot, in the depression distal to the junction between the second and third metatarsal bone. This point, the wood, which is the wood point and grandmother point of the stomach meridian. It is one point on this young meridian which actually tonifies its chin. Therefore, it can be used successfully in reducing acidity, vomiting, and upward dispersion of the stomach and makes the food flow downwards. Next point, we have the stomach 44. Check po natin yung picture, which is located between the second and third toes, proximal to the interdigital fold. Ang point is commonly used meridian distal point and a pain relief point. It is especially effective in treatment of pain along stomach meridian regions of the face, the temple, TMJ joint, and lower jaw, and the treatment of lip problems. It is also the water point of the meridian, which means it can serve as a sedation point. Next point, we have stomach 45, which is located on the second toe, 0.1 tune from the lateral corner of the nail. Itong point is the sedation point and metal point of the stomach channel. Often, it is not used for sedation because it is the core. In such case, sedation of stomach 44, the water point, so we use stomach 44 instead of stomach 45, would be just as effective but not so painful.